Oh, hi there. Feeling like rubbish. Do not feel good at all right now. And I've been switched over to a medication that I've had it before, didn't like it before, don't like it now. Called Abilify. It's on the long list of medications I don't like. However, this one seemed to have some properties to it which reduced the sore throat I've had for so many years. Something about it, I don't know what. However, it is proving, I've been taking it about a week. It's been proving less effective in doing it, which is the only reason I take it actually. I'm not required to at any point in time, unless my body tells me I'm required to, because it's got some dependency problems with it. Not only that, but like I'm on bare bones minimum dosage. Like I don't even want to take that. But it actually causes schizophrenic symptoms. And I know what schizophrenic symptoms are. It's important to be able to recognize these sort of things for anybody, really. And, there's a lot of factors that can play into how schizophrenic symptoms appear and why. And it's not always the medication. It's a big part of the medication, but it's not the only thing. There's, social factors. There's stressors in your life. For me, they're nagging, festering problems. They simply do not go away, and nobody wants to accept them. And they're not my fault either. Not my fault. So it doesn't help if there's this streak, or like an underlying factor that's maybe pissing you off, because anger brings out a lot of what would look like schizophrenic symptoms. Quite often it does. And then, medication that you're told is supposed to treat those problems, and it only actually makes them worse. I approached my psychiatrist about the last dosage of olanzapine I received and how it was different than the previous one. It simply was. My body was doing different things. I was sleeping at different times. Um, for some reason, I had more bowel movements. I don't know why I would, but for like the entire time I was on the what I believe to be a different dosage of olanzapine, I had a lot of bowel movements. I don't know. I don't have any other explanation as to why that would be. And there were a handful of other things, but not being able to sleep properly. And it was a complete contrast to what it was doing before. So I am concerned about making this video because, what if the next batch of Abilify is different? What if it's different every time I take it? And you can't bring these subjects up without looking paranoid to your doctor, because you could look at your doctor, your psychiatrist, and go, "You're a fucking liar." You can tell them right to their face, and that's what they fucking deserve. Because they're all liars. And I was speaking to a pharmacist, and they were telling me, because I was explaining how the medication was doing different things than it was before, and it's supposed to be the same thing, says the same thing on the bottle, but it's not. And they described this Abilify as that will stop that kind of thinking in my head. Except, not only it didn't do that, I started, really thinking about it and not liking it at all. I mean, who would like this situation? I think any normal person who is in a position like this would be pissed off, unhappy, and, if you're not crazy when you go into mental health, you sure will be when you get out. And they are really trying to prove that point, in my opinion. Yeah, so I feel like rubbish. I do not feel super amazing. I will continue to take this Abilify because it sort of helped with a sore throat. And this is the stressor factor. I've had this sore throat for so long, and there are people who are actually convinced I'm never going to get rid of it. Now, that's morbid negative thinking. I don't think that way. But obviously, as I gotta think of it anyway, because it's been a long time. Very, very long time. And, a lot of people don't give a rat's ass. That's their prerogative. Fuck them. Yeah, I wouldn't recommend Abilify for anybody. If you have the option not to take a psychiatric medication, do not take it. It's nothing but bad for you. I don't even want to think about what it's doing to my organs on the inside. Probably nothing good. Ugh. Yeah. Really tired of this crap because I've had to explain. Again, I explained it to my psychiatrist, and I said, look, you can get rid of this sore throat, the one that you gave me. You just don't want to. There's a difference. And it has that manipulative effect. And it really feels like it's the same routine over and over and over again. And they think over time it'll simply I'll do what they want me to do. I don't know exactly what that is. But I think this is abusive, and it's a vicious approach to treat a patient. Any patient. And, they're not going to agree with that. They don't want to agree with that. But that's the way how I see things. And, I don't know. There is the possibility that medications simply affect other people differently based on their genetics and other factors. But I think that's a crock. I think that most of the symptoms, whether they're put in there on purpose or not, they usually are quite deliberate, and they're so potent that there's no way anyone else would react differently to this particular combination of medications. And many people never suspect that the medications that they take can and will be changed at any time for any reason. Like, they might find something 5 years down the road that's cancerous about a particular medication, and they'll just simply remove that and replace it with something else because they don't want to own up to it that it's a cancerous medication. They don't want to do that. So, that's something to think about. And they want to test people. They want to experiment on them. They want people to be on a medication for an extremely long time. And then, they'll get their vitals checked out and all that kind of crap, right? And once that happens, they can get a good reading as to what these medications do long-term to people. And once they know that, they'll prescribe it more if they're seeing the things they want to see in it. They got this thing like where they want you to feel like crap all the time. But, it's not lethal. It's not cancerous. It's not going to finish you off. It's simply institutionalized abuse and flat-out torture, actually. I've had so many people talk to me like crap over the years, especially psychiatrists, and it's because they're not a particularly smart bunch of people. If they had to start talking, then all their lies would dissipate. They would start to crumble because they do not actually have good reasons for things that don't sound completely stupid. For the very few times I hear them talk, it's like, really? Is that the story you're going to go with? Because you sound like a fucking retard. There have been a number of occasions where I didn't say it, but I most certainly thought it when I was dealing with mental health professionals. I went, you're a complete fucking retard. You know that, right? An overpaid, complete fucking retard. I know that's not a nice thing to say, but they say a lot worse things about people than you even know. And I think it's downright unacceptable. But, for some reason they're held in high esteem in society because people don't know who they are. And, they figure, well, anyone who's in the system deserves to be there. They're an inconvenience for society. And, they simply are irritating and annoying, and therefore they have to be put in a place. And it's like, fuck you, asshole. Fuck you. And, that isn't what they want to hear from me. I know that for a fact. They want me to praise their medication and tell everybody how great it is and how much better I feel about myself, when that's simply not true. I will probably have to increase the dosage. Not right away, obviously. I'm going to take this stuff for as long as possible at the minimum dosage before I even consider taking more. And I'll probably have to do that because, as I said earlier, the properties in the medication that was alleviating the sore throat are starting to dissipate already. The first few days, it was like the sore throat was gone. And now it's starting to come back. And it's like, when are they going to stop being so abusive? When? Like, seriously. Like, these people. And, it's like, it's something other. It's like they're modern doctors, but they have a medieval mindset. And that's how they move forward with, their treatment plan. And it's like, is this, the pinnacle of society, from a first world perspective? Is this the best that we've got? Because this system is plagued with problems, and it's, it's really a stain on the flag of this damn country. And, a lot of people say, oh, you don't know what you're talking about. I do know what I'm talking about, actually. And, you can't listen to what other people say. Well, I mean, you can, but if they're telling you you're wrong and they're not giving you a reason why you're wrong, then obviously they're fucked up in the head. Anyway, so taking Abilify, minimal dosage. Hopefully the sore throat kind of dissipates. We'll see how that goes. Because I do not feel good right now. Feel like rubbish. Anyway, talk to people later. Have a good one.